Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Thank you so much for joining us in this episode of Being Well. Today we're going to be talking about the endocrine system. And I have a special guest here with us today, and this is Dr. Rico, an endocrinologist with Paris Community Hospital. Thank you so much for joining us.
Oh, thanks for the invitation.
So we're going to be talking about the endocrine system. So explain to me, what is that?
Okay. The endocrine system involves the study of hormones, which are these little chemical messengers that are produced in glands within the body, and they're distributed in the bloodstream.
Okay. So as an endocrinologist, what do you treat?
Yeah, the majority of patients that we see are for diabetes, which is perhaps half of our patients, and then maybe a third are for thyroid issues.
Okay. So explain to me a little bit about maybe, you said half is diabetes. So do they know to come to an endocrinologist such as yourself, or how does a person start out if they have such an issue?
Yeah, that's a great question, because the vast majority of patients with diabetes are cared for by primary care. Perhaps 80% of patients with diabetes are managed very capably by primary care. So the reality is the majority of diabetic patients will never see an endocrinologist in their lifetime. There are patients that would really benefit from evaluation and management with an endocrinologist, which typically focuses on patients with type 1 diabetes, which is generally younger patients who lose the ability to produce insulin. There's also patients that have the adult form of type 2 diabetes, but when they go on to require insulin or more intense therapy, there's a large number of those patients that may benefit by being seen by an endocrinologist.
Okay. And then you mentioned thyroid. So talk to me a little bit about thyroid problems.
Yeah. Patients with deficiency of thyroid hormone have been around for as long as people have been around. We've had reports and historical records of patients that demonstrated evidence of hypothyroidism, where they were very fatigued and had trouble feeling very cold and tired, and trouble with different body functions. Thyroid hormone was first isolated and identified at Mayo Clinic in 1915, and that really kind of ushered in the age of endocrinology, with the discovery of thyroid hormone. So patients that have low levels of thyroid hormone, they'll often be quite fatigued, and they'll have lots of trouble with regulating body temperature. We have the ability to provide thyroid hormone replacement with both generic and name brand medications to allow these patients to feel much better than they do with deficiency.
Okay. Now there's hypo and there's hyper, right?
Right.
Okay, what's the difference?
Yeah, patients with hypothyroidism actually have a deficiency of thyroid hormone, so they require replacement. And patients with hyperthyroidism, they overproduce thyroid hormone. And those patients will typically require either surgery, or often they're taking oral medications that slow down production of thyroid hormone.
Okay. And is there a difference in whether a person is male or female, whether it's hypo or hyper? Is there any similarities, any differences?
Yeah, the vast majority of patients that have thyroid hormone disruptions, those issues are mediated by the immune system. And we know the immune systems in women are much different than those in men. For example, For patients with autoimmune Hashimoto's thyroiditis, which is the most common cause of hypothyroidism in the U.S., about 8 times as many women as men have that condition,
Really?
although plenty of men have it as well.
Okay. And does it depend on age at all?
No, not really. I mean, we see adults that are newly diagnosed with thyroid disruptions as well as young children as well.
Okay. Now, when we first began this program, you mentioned hormones. How do hormones play in with the glands and all these different things that can lead people to see you?
Mm-hmm. Well, again, hormones are these kind of chemical messengers, things that we think of like insulin, like thyroid hormone, cortisol, growth hormone. They are produced in specific glands within the body, and then they're released into circulation in the blood, where they circulate all over the body, and many tissues within the body, both in the periphery of the body as well as, for example, the central nervous system, will have receptors for these hormones.
Okay. Are there just pediatric endocrinologists that people need to seek out for their children's care?
Yes, there is a specialty in pediatric endocrinology where physicians who are initially trained in pediatrics go on to subspecialty training in pediatric endocrinology. They're incredibly difficult to find once you get outside of large cities with academic medical centers. So in many cases, in community endocrinology practices like ours in Paris, even though my training is in adult internal medicine, we see pediatric patients as well.
Okay. And what are some of the different issues that you treat with children that may differentiate themselves from adults?
Okay. Well, children have some of the same concerns as adults have, for example, with the type 1 diabetes where they lose the ability to produce insulin. Pediatric patients can also experience both hypothyroidism and hyperthyroidism. They have a tendency to experience certain other conditions that are normally seen in pediatric patients, not so much in adult patients. For example, we had a recent diagnosis of a 7-year-old patient with a growth hormone deficiency. And that's very important to identify in a young child to make sure that he's able to achieve his expected full adult height.
Yeah, and that would be a concern, a great concern, I would think, for not only the child, but for the parent as well. So what do you work through with the parents as a treatment or something like that when you're working with a child? Because something like that might be kind of scary for a child too.
Yeah, it's very scary to go through this whole process of evaluation and the testing that's required to come up with a diagnosis, prior to deciding on a plan for management. All of our patients, including the pediatric patients, are referred from primary care. In an area like Paris, we have lots of family medicine physicians. They see both pediatric and adult patients. But patients that were referred from other areas may come directly from a pediatrician as a primary care physician. One of the advantages that we have with pediatric patients is they're monitored for their both height and weight changes over time, so we can follow whether there's a concern that they may be falling off an expected growth pattern, either for weight or for height. And that's often the first clue for the patient or for the patient's family that there may be a concern.
Okay. I have on my list here that osteoporosis is also part of something that is treatable by an endocrinologist. Talk to me about that.
Yeah, bone mineral density issues are another concern that are much different typically between women and men. We know that in females, bone mineral density peaks early in life, in the late 20s, maybe as late as age 30. And after that time, when that's the highest bone mineral density that person will ever achieve in their lifetime, bone mineral density will tend to decrease very slowly until menopause. And then after the rapid drop in estrogen levels that come with menopause, bone mineral density can decrease even 4 or 5% for the first few years. So there's quite a few patients that don't find out about osteoporosis until say, age 60 or 65, or if they experience a fragility fracture, which would be a broken bone from some condition that wouldn't be expected to result in a fracture.
Okay. Let's talk about some of the symptoms that people maybe are experiencing that are watching this program right now. They're trying to figure out, hey, do I have diabetes? Do I have a thyroid problem? What's some things that, let's go through a list here of some symptoms that people need to pay attention to with diabetes.
Mm-hmm. Yeah, one of the first things that patients with diabetes will notice is that they're very fatigued. In addition, due to the influence of the kidneys with trying to offload some of the additional sugar that's found in the blood, patients will notice an increase in frequency of urination. That will tend to make patients very dehydrated, and at the same time they become quite thirsty. So they'll find that as a result of exposure to elevated blood sugars, they have a significant increase in the amount of urination as well as the amount of liquids that they're consuming.
Okay.
Many of these patients will find that they lose weight unexpectedly or unintentionally. And that can be a sign of the body shifting from metabolism of glucose, sugar, into metabolism of fats.
Okay. Is there anything else with diabetes that they need to pay attention to as far as symptoms they may be having?
We're often concerned about some of the influence of elevated blood sugars on areas like the feet, the kidneys, and the eyes. And that's why those are the location for the classic diabetic complications. So patients may experience changes in sensation in their hands and feet, as well as changes with, we talked about increased urination and thirst. Patients will often notice a blurring of their vision due to the elevation in blood sugars drawing more water into the eye.
Okay. And let's move on to thyroid. What are some symptoms that people need to pay attention to with that?
In many cases, patients become concerned because they're experiencing trouble with temperature regulation. They feel cold all the time, even in situations where other friends and family members feel comfortable. Patients may notice changes due to slowdown of their metabolism from the perspective of gaining weight unexpectedly, as well as issues with fatigue. Patients with elevated thyroid levels are kind of the opposite. They often feel sped up. They may have a rapid heartbeat, skip beats. They may have heat intolerance. They'll often have nausea, vomiting, that kind of thing.
Okay. A few years ago, I went to, just as a checkup type of thing, a special thing that was offered to get my carotid arteries looked at, because we have heart disease that runs in my family. And when I went and had that scan done, they found thyroid nodules. Mm-hmm. So talk to me about those, because I'm interested in that as well.
Okay. Thyroid nodules are actually very common, and it can be a little bit scary for patients to be told, guess what, you have a thyroid nodule. But thyroid nodules, again, very common. We think that maybe up to half of all adults have thyroid nodules. Thyroid nodules are very common, but problems with thyroid nodules remain fairly rare. So we think that perhaps 95 or 97% of thyroid nodules are benign and don't create much in the way of problems. But there's a small percentage of thyroid nodules that have the beginning of thyroid cancer, and that's why we pay attention to them.
Okay, and probably people like me have to go get scans every year and keep a check on them and things like that. What's the protocol?
Well, anyone that has a thyroid nodule will end up in some kind of lifelong surveillance. Because thyroid nodules are so common, we don't evaluate every thyroid nodule in every patient, but the American Thyroid Association recommends that we pay closer attention to some of the larger ones that are greater than 1.5 to 2 centimeters in size.
Okay, so if they grow, you need to pay attention to that.
Yeah, thyroid nodules can follow a little bit of a 1/3 rule. 1/3 of the time they'll get bigger, 1/3 of the time they'll get smaller, and 1/3 of the time they'll stay the same. But in general, anyone that has a history of a thyroid nodule will go through some kind of radiographic surveillance with ultrasound. Ultrasound is the most sensitive imaging that we have for the thyroid, so it's much better than an X-ray or CT or even MRI.
Okay.
And the vast majority of patients that have thyroid nodules learn about them the way that you did. They were incidentally discovered on some other kind of imaging.
Yeah. Hormones, that's on the list as well, and we've already talked about it a little bit, but being a female, I know there's a lot of hormone changes that happen, as you mentioned, menopause and different things like that. Is there anything that people should pay attention to or pay attention to their body that maybe they're just thinking, oh, that's just, I'm just tired, or, what should they really pay attention to? What are some symptoms with hormones?
Right. The most important thing to be aware of is that we want all patients to maintain a good relationship with their primary care physician. That's who typically knows them the best, and they can be on the outlook for things that are different from their typical baseline. Issues with hormones can be a little bit frustrating to diagnose because the typical adult that I see is fatigued. I don't know any adults that are not fatigued.
Right.
But there's a difference between patients that are kind of normally tired at the end of the day and patients that really find that they're not able to perform activities that they normally would. So we do hear a lot from patients that will say, I work 50 hours a week and I come home and I want to lay down on the couch and I don't have the energy to do anything else. And that's really a warning sign that perhaps there's something from a hormonal or a metabolic standpoint that's going on.
Okay. And is it kind of tricky to treat that when it comes to hormones and different things like that? And in hormone replacement therapy as well, you have to find a balance, right?
Yeah, in our business, in endocrinology, whenever possible, when we determine a patient has a deficiency of some hormone, like hypothyroidism, like estrogen deficiency after menopause, we do try to replace the hormone that's missing. And when patients have an excess of some hormone, then we try to either reduce or suppress that in some way to always bring the patient back into the range where we think a person that has normal function would be.
Okay. And then osteoporosis, what's some symptoms that folks should pay attention to?
Again, any patient that has had a fracture from some kind of situation that wouldn't be expected to cause a fracture. Obviously, bones can break if you hit them hard enough, but I have seen patients that had a fracture of a rib, for example, just putting on their seatbelt in their car.
Oh my goodness.
And that's obviously something that's not normal. Patients with certain medical conditions that may predispose them to osteoporosis, we do keep an eye on. Often patients that have had exposure to steroid medications like prednisone, for example, for respiratory issues like asthma or for rheumatoid arthritis, for example, over time, exposure to those medications has a negative influence on bone mineral density, and that can predispose the patient to osteoporosis.
So do you need to be later in life to experience osteoporosis, or is that something you can experience at a younger age?
Yes, that can certainly occur at a younger age as well. For example, with male patients, we'll see male patients from time to time that have a fracture, as I described, a fragility fracture from some kind of situation that wouldn't be expected to result in a fracture. And part of the evaluation is not just to put them on treatment for bone mineral density, but to try to determine whether there's a secondary cause for the osteoporosis. In male patients, we'll go through and do testing to assess for evidence of testosterone deficiency, which can also be associated with osteoporosis in male patients.
Okay. So we've gone through what the issues might be, a few of them. I'm sure there's a lot when it comes to the glands and hormones and all these different things with the endocrine system that we haven't covered. But what are ways that folks can prevent? Are there prevention measures that they can take to prevent some of these different things from occurring?
Yeah, that's really a great question because, for example, with diabetes, this is asked all the time, and it's actually been studied in a great deal of detail. About 15 years ago, there was a landmark clinical trial that was conducted by the National Institutes of Health where they looked at trying to delay or prevent the onset of adult diabetes in patients who had blood sugars that were not quite in the normal range and not quite in the diabetic range. So those patients were clearly at risk to progress to full-blown diabetes. And it was determined at that time that there's a lot to be gained from both lifestyle modifications, increased physical activity, attention on nutrition, as well as effective medical management. And that was associated with reducing the incidence of patients progressing from a pre-diabetic stage to full-blown diabetes over the course of that trial.
Okay. And what about prevention measures for some of the other things that we mentioned? Paying attention to diet or exercise is always a given, but what
Sure.
other things can people pay attention to?
Well, the foundation of what we do for patients are with lifestyle modifications. So we're always going to recommend physical activity. The general recommendations are 30 minutes of moderate physical activity, things like brisk walking, 5 days per week. That's been associated with measurable cardiovascular benefits. Since we're talking about things to look out for, we often focus in diabetes on the classic complications with the feet, the kidneys, and the eyes, and for good reason. We know that diabetes is a leading cause of blindness in the U.S. for people younger than 75. It's also the leading cause of kidney failure in the U.S. But at the same time, we know that patients with diabetes typically don't die of any of those issues. It's heart disease and stroke that we're really concerned with for those patients. So for those reasons, we also pay a lot of attention to blood pressure and cholesterol, because control of those issues has been associated with helping people to live longer.
Okay. And we've talked about some medical treatment as far as medicines. Is there anything that you have to do that's surgically or anything like that that you have to treat with any of these issues that people may have?
Well, for example, we talked a little bit about thyroid, and patients that have overactive or hyperthyroidism, that can be associated with an autoimmune condition called Graves' disease, or it can be associated with thyroid nodules that inappropriately produce excess thyroid hormone. In many cases, definitive treatment for those issues can include surgery. It doesn't have to, but that's one of the options for definitive treatment. In those patients, following the surgery, then they'll have a lifelong requirement for thyroid hormone replacement as they no longer have a functioning thyroid.
Okay. We have a couple of minutes left, and I want to talk about what resources are available out there for people to educate themselves on.
Yeah, to focus a little bit on diabetes, I mean, it's incredibly complicated to manage patients with diabetes. And when it comes to the adult type 2 diabetes, which involves about 90% of our patients, they're always asking, what exactly is the core metabolic defect that causes type 2 adult diabetes? And in reality, it's not a single core defect. It's at least 8 different core defects. So in addition to effective medical management, these patients, especially upon diagnosis, require support in terms of education about diabetes, about management of the different medications, about the lifestyle changes with physical activity and nutrition. At our facility in Paris, we have the benefit of having an American Diabetes Association certified diabetes education program, where we have a certified diabetes educator as well as a nutrition specialist who can help with some of those issues beyond just the medical management.
Okay. What got you interested in this field?
Well, my undergraduate degree is in mechanical engineering, so I was always kind of predisposed to things that looked at kind of a logical problem-solving process. So when I first started learning about the thyroid and about diabetes, I just found them fascinating.
Well, I hope that the folks who have joined us today have found this fascinating. And if you are experiencing any of the issues that maybe we've talked about today, we hope that it has been an educational value to you, and we hope that you're living well and being well. I'd like to thank you for joining us today. We have Dr. Rico once again from Paris Community Hospital, an endocrinologist who has spoken about the endocrine system, and we want to thank you again for being here with us today, and we want to thank you for viewing this episode of Being Well.
Production of Being Well is made possible in part by
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org.
Rediscover Paris.
Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.